Hello everyone. Today onwards, let's discuss about the pharmacology of drugs which acts on respiratory tract and gastrointestinal tract. In the last class, we have discussed regarding the classification of drugs which are used in respiratory tract and in gastrointestinal tract. And from today onwards, we will learn about the pharmacology of the drugs which are used to treat these disorders. So the first one we will see asthma. So what is asthma and what is the pathophysiology of asthma you see? Asthma is nothing but it is a bronchial constriction because of airway inflammation. Because of the swelling of airways, it causes constriction in bronchial smooth muscles. Because of that, airway is blocked. So any triggering reason means asthma may be because of different reasons, because of different allergies, asthma is caused by any individual. So because of that, any trigger factor causes airway inflammation. Airway of human being inflammation occurs, means swelling of the airway will occur in a human being. And this airway inflammation will in turn, it will cause hyper secretion of mucus. The mucus is secreted more and more in the airways. Because of that, airways will be blocked and it results in airway muscle constriction. The airway muscles are constricted because of the mucus. And it also causes the swelling of bronchial membranes. Bronchial membrane swelling will occur. This in turn leads to narrow breathing passages. Human being cannot breathe properly when it occurs. Because of narrow passages, he cannot breathe properly. Then he gets symptoms like wheezing, cough, shortness of breath, and tightness of chest. You will feel tightness in the chest. Next, the drugs which are used for asthma, the main drugs, the first one is salbutamol. Let's discuss the pharmacology of salbutamol. So what is the salbutamol? Salbutamol is a beta-2 adrenergic receptor agonist. So it is an adrenergic receptor agonist, salbutamol, and it mainly provides symptomatic relief and prevention of bronchospasm. Bronchospasm. Spasm means constriction. So the constriction of bronchial smooth muscles is called as bronchospasm. So this salbutamol drug will reduce that bronchospasm. If bronchospasm is reduced, means it will dilate and it will relax the bronchial smooth muscles. Then what is the mechanism of action of salbutamol? You won't see here. See, the salbutamol activates mainly beta-2 adrenergic receptors in airway smooth muscles. When these receptors are activated, this in turn leads to activation of adenyl cyclase enzyme. Adenyl cyclase enzyme. This adenyl cyclase enzyme, when it is activated, it increases the intracellular concentration of adenosine monophosphate levels. AMP levels are increased when adenyl cyclase enzyme is activated. So these AMP levels, when they are increased, then it leads to activation of protein kinase A. Protein kinase A factor. This protein kinase A factor will inhibit the phosphorylation of myosin and lowers the intracellular ionic calcium concentration. It lowers the intracellular ionic calcium concentration. When intracellular ionic calcium concentrations is lowered, then it results in relaxation of bronchial smooth muscles. So bronchial smooth muscle relaxation will occur when these things happens because of this salbutamol. Then uses of salbutamol, it is mainly used in treatment of asthma, chronic obstructive pulmonary disease, and it is used as a bronchodilator and it relaxes the muscles in airways. And side effects of salbutamol, mainly it causes tremors. Tremors are nothing but fits, headache, palpitations means low pulse rate, and increased heart rate, and muscle cramps. These are the side effects of salbutamol drug. Next one is ephedrine. So this ephedrine is also a sympathomimetic amine. It also activates adrenergic receptors. Then mechanism of action of ephedrine is mainly it activates adrenergic alpha and beta receptors. Alpha and beta receptors are activated by this ephedrine. When these receptors are activated, then it inhibits the ephedrine reuptake and increases the release of epinephrine in nerve cells. So when it increases the epinephrine in nerve cells, so large quantities of epinephrine will be present in the nerve cells for longer period of time. When large quantities of epinephrine is present for longer period of time, automatically it increases the stimulation of sympathetic nervous system. The sympathetic nervous system is stimulated and it causes the rise in blood pressure and also causes bronchodilation, means relaxation of bronchial smooth muscles. So this is the mechanism of action of ephedrine. Next, theophylline. So theophylline is a methylxanthin class drug, and the mechanism of action of theophylline is mainly it acts on lungs and ligand-gated receptors of cell membrane. When it acts on lungs and ligand-gated receptors, it mainly blocks one enzyme. That enzyme is called as phosphodiesterase enzyme. It blocks phosphodiesterase enzyme. When phosphodiesterase enzyme is blocked, automatically it blocks sarcoplasmic reticulum. Sarcoplasmic reticulum. When the sarcoplasmic reticulum is blocked, it in turn decreases the calcium input and bronchoconstriction. So automatically bronchodilation is improved. If bronchoconstriction is decreased, means what? Then it means bronchodilation is increased. It means relaxation of bronchial smooth muscles is increased. Next one, Montelukast drug. See, the Montelukast acts mainly on submucosal layer of lungs and it blocks lipooxygenase enzyme. When the lipooxygenase enzyme is blocked, then it decreases the synthesis of leukotrienes and eosinophils. When the leukotrienes and eosinophils synthesis is decreased, that means bronchial constriction is reduced and bronchial smooth muscle relaxation is increased. So this happens when leukotrienes and eosinophils are reduced. So automatically it treats asthmatic conditions. So this Montelukast is mainly absorbed orally and half-life of this Montelukast is 3 to 6 hours. Another class of drug is used same like Montelukast, that is zafirulukast. The half-life of zafirulukast is 8 to 12 hours. And these two are mainly used in mild to moderate asthma cases. When you use these two drugs in mild to moderate asthma cases, no need of steroids. You should not use steroids. It will also help as steroids, Montelukast and zafirulukast. Next, hydrocortisone and prednisolone. These are glucocorticoid drugs. Then what is the mechanism of action of glucocorticoids? These glucocorticoids mainly inhibits neutrophil apoptosis. This neutrophil apoptosis, when it inhibited, it in turn results in inhibition of phospholipase A2 enzyme. When phospholipase A2 enzyme is inhibited, so automatically it decreases the formation of arachidonic acid derivatives. When arachidonic acid derivatives formation is decreased, then it increases the anti-inflammatory action. Anti-inflammatory action is increased so that they can treat the asthmatic conditions. Next, Ketotifen. Ketotifen is also it also inhibits the release of mediators like mast cells, macrophages, eosinophils, and lymphocytes. When these mediators are inhibited, automatically it improves the functioning of lungs and it also improves the functioning of airways. So for this type of drug, there is a therapy needed for at least 6 to 12 weeks for the patient. And this Ketotifen is also used in rhinitis condition and conjunctivitis condition and also in food allergy condition. So this is about anti-asthmatic drugs pharmacology of anti-asthmatic drugs. These are the drugs mainly used for treating asthma, and this is the mechanism of action of these drugs. Thank you. Jai Hind.